All right. Hello, good morning, America. Good afternoon, Europe, Africa, and good evening, Asia and Australasia. I am Napapong Pongnapang, your ISRT Vice President for Asia and Australasia region. I'm very happy to be here today on this special event. Normally, we have our Facebook Live on Sunday, but today is very special day. Today is World Patient Safety Day. Actually, today, World Patient Safety Day was initiated by the World Health Organization. And why we are here today is we want to show the world and also to our colleagues around the world that radiographers and radiological technologists, we celebrate World Patient Safety Day. And we will have the leader from our profession from around the world to share the experience on different aspects of the patient safety. For the objective of the World Patient Safety Day in 2020 from World Health Organization, the objective include raise global awareness about the importance of health worker safety and its interlinkage with patient safety. And the second objective is to engage multiple stakeholders and adopt multimodal strategy to improve the safety of health workers and patients. The third objective is implement urgent and sustainable actions by all stakeholders, which recognize and invest the safety of health workers as a priority for patient safety. And the last objective is provide due recognition of health workers' dedication and hard work, particularly amid the current fight against COVID-19. And today, we are so honored to have representative from the World Health Organization, our longtime friend and always work with us, Dr. Maria Perez. She will be our keynote speaker today. Please welcome Dr. Maria del Rosario Perez.
Good morning, good afternoon, good evening to everybody in different regions of the world. It is a pleasure for me to be with all of you to celebrate together this new World Patient Safety Day. I will share with you some WHO's views regarding the role of radiographers and radiological technologies to make a reality the theme of this celebration: safe health workers, safe patients. I will start reminding the objective of the World Health Organization as the attainment by all peoples of the highest possible level of health, acting as the United Nations directive and coordinating authority on international health work. If we talk about health, it's also good to remember the definition of health in WHO Constitution as a complete state of physical, mental, and social well-being, and not just absence of disease or infirmity. In this context, the UN member states made a commitment to achieve 17 Sustainable Development Goals by 2030. All the 17 SDGs have direct or indirect implications on human health and well-being. But there is one specifically focused on this, and it is the SDG number 3, to ensure healthy lives and promote well-being for all at all ages. And this SDG number 3 is also focused on achieving universal health coverage as a high priority for all UN member states, but particularly for WHO and its member states. And this includes safety and quality of health services. So it's a good opportunity also to remind that ensuring safety and appropriate use of radiation in healthcare contributes to achieving universal health coverage. as you probably know, the governing body of WHO is the World Health Assembly. In 2018, the WHO Health Assembly number 71 approved the 13th WHO General Program of Work. We are currently implementing this GPW13, and it sets a so-called triple billion target, which means 1 billion more people benefit from universal health coverage, 1 billion more people better protected from health emergencies, and 1 billion more people enjoying better health and well-being. You can find the full program of work in the website. I am sharing the link. But this slide wants to show to you in a visual approach the interlinks between the three, what we call the 3 billions. You can see that working to improve the quality of the health and well-being of the people is at the same time very much linked to universal health coverage, and today more than ever we can see that it is very much linked to having people better protected from health emergencies. And this is very much linked also to quality in healthcare. And this slide wants to share with you the dimensions of quality of care, which are, as you can see, there are several dimensions. But to make the point that safety is one of them. And then the safe and appropriate use of radiation in healthcare, either for diagnosis or for treatment of disease or injuries, is embedded in this concept of healthcare quality. The World Health Assembly last year approved a resolution on global action on patient safety, recognizing that this is really a growing challenge for healthcare delivery. And this resolution has two calls. One call to countries, to member states, to recognize patient safety as a health priority for policies, for programs, for actions, but also a call to WHO to formulate a global patient safety action plan. So in response to this, during 2020, WHO developed, or so far drafted, a global patient safety action plan, proposing a framework very much action-oriented to facilitate the implementation of these strategic interventions on patient safety in the coming decade until 2030. You can find this draft in the WHO website. I am sharing the link with you. And until the end of September, you can share also your comments, which are very much welcome. So I invite all of you to read the draft and to send comments to WHO. We have no time today to go into details, and you can see the draft on the web again. But I just want to share with you this picture to make the point that this patient safety action plan has one vision, one mission, one goal. Identify 4 partners for action: the governments, the healthcare facilities, a long list of relevant stakeholders, and the World Health Organization. It proposes 6 guiding principles and 7 strategic objectives, including making zero avoidable harm to patients, building high reliability health systems, ensuring safety of every clinical process, engaging and empowering patients and families, inspiring, educating, and skilling the health workers, ensuring a constant flow of information and knowledge, and last but not least, definitely, promoting a sustained, multi-sectorally, multinational, multidisciplinary partnership to improve patient safety. And definitely, this action plan considers the enhancing the safety of patients as well as health workers. And these are just examples of points or excerpts from this draft global patient safety plan. And you can see that it refers to minimizing harms to patients and health workers, inspiring, educating, skilling health workers to the design and delivery of safe care systems, minimizing again the risk of harms to patients and health workers. Also leverage opportunities on national law, norms, frameworks to strengthen measures to protect patients and health workers and promote a culture of safety for both. So the World Health Assembly also last year established this World Patient Safety Day on the 17th of September to recognize patient safety as a global health priority. This happened last year. This year, we all know what happened. We are all facing the COVID-19 pandemic. The WHO response to the COVID-19 pandemic demanded huge efforts, and the same happened to the response in all countries. I don't need to let you know that because all of you are involved in a way or the other in this response. We learned already many lessons from COVID-19 response, and one of the lessons was that COVID pandemic posed and is posing huge challenges and risks for health workers globally in all countries, high, middle, and low income countries. Also, we learned that working in a stressful environment makes health workers more prone to errors, and this can lead to patients' harm. So WHO decided, and also in consultation with the stakeholders that have been supporting the development of this patient safety plan, to focus the theme of the celebration of the World Patient Safety Day this year on this theme of health worker safety, a priority for patient safety. In this context, we continue working on in WHO, in our radiation unit, on this global initiative on radiation safety in healthcare settings to promote safety and quality in the use of radiation in healthcare in the area of risk assessment, management, and communication. This initiative is currently focused on supporting the implementation of 10 actions to improve radiation protection in medicine, the so-called Bond Call for Action. I think that most of you already know and are already working and supporting these actions to enhance patient safety and health worker safety. And these actions are dealing with different topics like justification, optimization, engagement for manufacturers, education, training, research priorities, data collection, reporting and learning, safety culture, communication and benefit risk dialogue, safety standards. My message now on this, based on these 10 actions, is that radiographers and radiological technologists have a key role in the practical implementation of these actions. During the COVID-19 pandemic response, we also learned that from the beginning of the outbreak, there was an increasing demand of advice regarding the use of chest imaging that was being used all over the world, and guidance was very much requested by our member states. So WHO worked on the development of guidance on chest imaging in COVID-19, clinical guidance, implementation considerations, identifying research gaps, providing briefs on infection prevention and control. These documents are now available in 7 languages in the website. You have the link there. We have been working on derivative products. So the rapid advice guide plus technical specifications for imaging equipment that will be published in a few days, a training package for frontline workers, a chest imaging section in the definition of a COVID probable case, manuscripts review, etc. I want to thank once more the ISRRT for the contribution provided to this project in different ways: technical input, checklists, peer review services, pictures for the training package, etc. These are the products, some of them already available on the web and some of them coming soon in the coming days. So we continue working to support the implementation of the international radiation basis safety standards in healthcare settings. These are the benchmark for radiation safety worldwide, adopted and supported by 8 co-sponsoring organizations, published by the IAEA, but WHO is one of those co-sponsoring organizations. So we are working hard to support this implementation. These standards, these safety standards, are based on the recommendations provided by the ICRP, the International Commission on Radiological Protection, which in turn are based on the scientific basis on effects, risks, sources, and levels of radiation exposure. Basically, for the UN agencies, our main source of information is the United Nations Scientific Committee on the Effects of Atomic Radiation, the UNSCEAR. So this is what we call the paradigm: science, recommendations, standards, and then the tools. And I want to mention here an important tool, which is a safety guide on radiation protection and safety in medicine, which has been published by the IAEA in cooperation with WHO, PAHO, and ILO, and it is available on the web, and I will share with you later the link. So it is important as a tool to support the implementation. Probably you know already, but just also to remind you, the ICRP develops the system of radiological protection around what we could call the rule of 3. The 3 principles: justification, optimization, limitation. The 3 categories of exposure: public, occupational, medical. And the 3 exposure situations: planned, existing, emergency. You can see this here. All 3 categories of exposure occur in the healthcare settings. And this is why it's so challenging implementing safety standards in hospitals, in medical settings. Because we have medical exposure of patients, occupational exposure of health workers, and public exposure of the visitors, family members, etc. Radiographers, radiological technologists, have a key role in implementing safety standards, in promoting safety culture, and in enhancing the protection of all these groups of people: patients, health workers, and public. Why? Because they are responsible for performing the procedures safely and accurately in all the disciplines: diagnostic radiology, image-guided interventions, nuclear medicine, radiotherapy. They are accountable for patients' health on all the healthcare pathway, before, during, and after the procedure. They are an interface between patients and technology. They are gatekeepers of safety for both patients and staff, and sometimes also for the public. And they are key players in safety culture and radiation safety culture in healthcare. We know that there are about, or even maybe more, than 7 million health workers that annually receive radiation doses attributable to their occupation in different conditions, with different levels of protection, different knowledge, different skills. And this happens in also many different disciplines. Those where health workers are really specialized in the use of radiation, but also health workers who use radiation modalities in the practice sometimes, and other health workers. I have no time. I will pick up 3 examples. Nuclear medicine health workers. They are exposed to many exposure scenarios. They administer radiopharmaceuticals in different routes. They perform injections with radionuclides. They should use different kinds of personal protective equipment. They are exposed to internal, but also external, both exposures, radiation exposure, and this should be managed, this should be controlled, and this should be assessed, the doses. Other point are pregnant workers. They don't have obligation to notify the pregnancy, but they should be informed about the risks of exposure of the embryo and fetuses, so they can make their own decision to inform in order to allow adapting the working conditions as necessary. To ensure that the fetuses, the embryo and the fetuses will receive the same level of protection, or at least similar to the protection we aspire for members of the public. They should use the dosimeter properly, etc. And the other third point I want to make is about radiation-induced cataract in health workers. The health workers are the largest group of workers with potential implications from the reduction in the dose limit of the lens of the eye by the ICRP a couple of years ago, some years ago. And this includes health workers dealing with fluoroscopy-guided interventional procedures, CT-guided interventional procedures, nuclear medicine procedures, particularly PET-CTs, and also radiotherapy, particularly manual brachytherapy. And the most affected are those workers dealing with interventional procedures. They are the ones receiving the highest doses in the lens of the eye. And to finish, I want to make a point around infection prevention and control for health workers performing chest imaging during COVID-19, because this is happening every day all over the world. Why we need to apply IPC to reduce the risk of infection transmission to both patients and staff. How we can apply IPC is simple, just modifying working practices and training the staff. What should be done to ensure appropriate personal protective equipment, PPE? But not just that, also training the workers on the proper use of PPE, adapting the standard operating procedures and the imaging techniques, and applying cleaning and disinfection in the working environment, in the equipment, in the devices. PPE for chest imaging usually is enough to use PPE and procedures for protecting against droplet transmission and contact transmission. So these droplet and contact precautions are usually enough for chest imaging for the health workers. However, if aerosol generating procedures are also performed, airborne precautions are required. You know that, just as a reminder, and you can find more information in the website. There is something that probably you will learn more today about contact, non-contact technique, wherever possible, when it is feasible. Ideally, 2 radiographers will perform the chest imaging, either chest radiography or chest CT, one positioning the patients, and the other radiographer staying in a so-called clean area. You can see more also in the rapid advice guide. And we thank the ISRRT and the King Chulalongkorn Memorial Hospital from Thailand for providing these pictures. To finish, some key messages for radiographers performing chest imaging. Remember, applying radiation protection considerations, keeping in mind that radiation-induced cancer risk is higher at younger ages. Applying the principles of justification and optimization and the standards of radiation safety to protect patients and health workers, with particular considerations for children and pregnant women. Remember the 4 IPC approaches: availability and appropriate PPE, training on proper use, adaptation of SOPs and imaging techniques, implementing cleaning and disinfection protocols, and if possible, working in pairs. You can find more some references here for further supporting information, free available on the website. And I just finished. Thank you very much, all of you, for your attention. And once more, thanking the ISRRT for this so kind invitation. Thank you. Bye-bye. Bye-bye to all.
Thank you so much, Dr. Perez, for your very, very informative presentation. Especially, you highlight the role of radiographers and radiological technologists in patient safety, not only in radiation protection, but in also the infection control. We will come back to you during the Q&A session. For the audience, if you have any question, please feel free to type in the comments box. It's going to be either below your screen on the Facebook Live, or it can be either on the right-hand side. We will take your question and then take the question to the speaker and the panelist. Thanks again, Dr. Maria. I will come back to you. The next speaker is from the ISRT, our organization. We have Stuart Whitley. Stuart Whitley is our Director of Professional Practice. Stuart will talk about the organization as the representative of radiographers and radiological technologists worldwide. Basically, we have a member for about 500,000 radiographers and technologists that belongs to us as a profession. Stuart will share the contribution of ISRT as the international and professional organization of radiographers. Please welcome Stuart Whitley.
Greetings to all my fellow radiographers and radiological technologists around the world. It's great to celebrate today and together the World Patient Safety Day 2020 and embrace the call for action, how you can embrace the safety of health workers and patients. As we have already heard from Dr. Perez, the objectives of World Patient Safety Day are to raise global awareness about the importance of health worker safety and its interlinkages with patient safety, engage multiple stakeholders and adopt multimodal strategies to improve the safety of health workers and patients, and implement urgent and sustainable actions by all stakeholders which recognize and invest in the safety of health workers as a priority for patient safety. And lastly, to provide due recognition of health workers' dedication and hard work, particularly amid the current fight against COVID-19. Something about ISRT. ISRT has been representing the radiography community internationally for several years. ISRT was founded in 1962 as a non-profit making organization, representing more than 500,000 radiographers from 86 member organizations with approximately 18,000 associate members. It has official recognition with the WHO and as a non-governmental organization. We work closely with the International Atomic Energy Authority, and we have UK charitable status. We're governed by council members meeting at a World Congress every other year. Now, ISRT is on a mission to improve the delivery of healthcare to people around the world by promoting quality patient care, education, and research, which supports the WHO call for action. How can you enhance the safety of health workers and patients? And as you can see from the slide, ISRT is composed of a council with council members coming from 3 world regions: Asia, Australasia, the Americas, and Europe, Africa. The council elects the ISRT board, which is composed of 12 members, supported by the CEO Support Services Manager. And as you can see from the slide, the president is supported by 3 vice presidents from the regions, together with 4 regional directors from Asia, Australasia, Americas, Europe, and Africa, and the directors of education, public relations, professional practice, plus the treasurer. And shortly you will hear important information that will focus on the specific health worker elements that lead to improved health worker safety. However, as a professional organisation and as an international organisation, ISRT has a number of obligations to support the radiography community. This includes working with governments to develop and promote legislation for the implementation of infection prevention and control, including access to sufficient and appropriate personal protective equipment, prioritizing and investing in health worker safety and patient safety, promoting and protecting health worker safety through capacity building, advocacy, and assisting in implementing safety standards, supporting health workers in their right to have a safe working environment, systematically monitoring compliance with these regulations related to health and safety of health workers. ISRT addresses these issues, and here are some examples of our activities to support colleagues in the working environment, which is ultimately to enhance the safety of patients. And as you can see from the slide, ISRT works closely with the IEA and WHO, serving on committees and contributing to publications such as the COVID-19 publications which come out from WHO recently, various technical documents, and safety culture and the health workers hub. Producing guidance documents such as the COVID-19 guidelines, the e-learning platform, which gives us also COVID-free webinars, the use of global webinars following COVID restrictions, development of position statements. And of course, we have the Chesney and funded workshops held throughout the world. We have our World Congresses. We have pre-World Congress workshops dedicated to radiation protection and education. We have the Bond Call for Action initiatives and monitoring their effectiveness. We have our annual Chesney Research funded projects. And of course, we work with organizations such as Philips and Samsung to run various competitions to raise awareness on radiation protection. And of course, we have got our World Radiography Day, which we use for various initiatives. And of course, the new ISRT website is a great source of information. And additionally, we have our news and views articles 3 times a year, which address many issues. The development of position statements has been going on for some time now. But as you can see, this is relatively important in addressing those topics which radiographers are involved in quite substantially, such as justification and optimization. So you can see to the right there the algorithm which we developed in terms of the justification, where radiographers are greatly involved. So we have position statements related to contrast media prescribing, and we also have it relating to image interpretation and the protection of vulnerable adults and children. And recently, of course, we have issued a position statement on the role of key frontline workers and the need for employers to recognize that as such and to protect them in their job of looking after patients. So you can see there are a number of position statements which are pending, all of which have been drafted, but we're waiting for council to approve those. Just a quick word of what we're doing in the background at the moment. We are in the process of a small working group working on a draft document entitled ISRT Safety Guidance in Diagnostic Imaging and Radiation Therapy Departments and Creating a Safety Culture. This is reflective of two important matters. One, the International Bond Call for Action, Item 8, which calls for medical professionals to strengthen radiation safety culture in healthcare. And ISRT therefore aims to produce a document that can be used to elevate standards of safety in healthcare. Additionally, at the 72nd World Health Assembly, a resolution was passed on a global action of patient safety, and the WHO Director General report on the global action of patient safety. In particular, this resolution mentioned radiation safety in paragraph 6. So we are developing a document which stretches right across the imaging department, dealing with all aspects of that involve safety, addressing those issues associated with ionizing radiation, magnetic resonance imaging, ultrasound, and radiotherapy, touching on various topics such as procurement of medical equipment and the control of infection, even things like moving and handling, and data security and environmental considerations. Important issues. So we will compile a document which we will share eventually, which will be a great aide-memoire. Now, it's good to know what we've been doing for many years and which we continue to do. Up to now, we've set aside approximately £20,000 annually to fund Chesney workshops, which focus on various topics which enhance patient safety and the knowledge base for the radiography community to work safely. This year, unfortunately, due to COVID-19 restrictions, our workshops have been curtailed. But here are some of the examples on the next two slides, which will demonstrate what ISRT have been up to, and even in conjunction with support from the International Atomic Energy Authority. So you can see in 2016, we've had a French African conference. In Kenya, we've had an English speaking conference dealing with radiation protection expert, with a radiation protection expert from South Africa. And we've had the trainers workshop in Togo and Nigeria with the help of the International Atomic Energy Authority. And as you can see from this side, we've been involved in projects in Indonesia, Myanmar, Senegal, and in Bulgaria with a joint project with the AFRS. So ISRT is involved in many activities, and one of the major activities which commenced in 2013 was the introduction of a funded research project to celebrate the legacy of the Chesney twins. So we have our annual Chesney research project. This year, 2020, the theme will be patient safety in medical imaging associated, excuse me, patient safety in medical imaging. Again, ISRT is encouraging and supporting the radiography community to enhance patient safety. As you can see from the slide, some of the winners and the topics involved. Last year, We touched on DRLs previously, ultra low doses in CT, and quality assurance and image registration for adaptive radiotherapy. And so the annual Chesney Research Fund encourages radiographers across the world to get involved in projects which will enhance safety. We all love when November comes. We plan for the World Radiography Day, and the celebrations over the years have touched on various topics. We take seriously the opportunity to celebrate World Radiography Day with the focus on an element of patients and staff safety. And this November the 18th, 2020, the topic will be elevating patient care with artificial intelligence. And as you can see, the many topics that we have touched on address patient safety, which is at the heart of our thinking and objectives. For 2020, this particular project will involve a publication of a booklet which will touch on the many different topics of artificial intelligence which radiographers are involved with. And as you can see in 2019, Your Safety, Our Priority was celebrated with the publication of a booklet which touched on various aspects of safety within the imaging department, right across all the different imaging modalities. You're encouraged to go to the website to actually see that. It's been my privilege to share with you today. There's a lot more I could have elaborated on, but please be reassured that ISRT is passionate in improving standards of patient care, and at the same time ensuring that radiographers and radiological technologists have the knowledge and understanding to undertake their work safely and professionally. Thank you for listening to me. Here's some images from Blackpool, a place where I live. Thank you.
Thank you so much, Stuart Whitley, our Director of Professional Practice, for sharing about the activities that the ISRT has done so far, especially the activities together with the World Health Organization and the International Atomic Energy Agency. We represent the radiographers. We are your voice worldwide. And the session after this, we will have two speakers that will talk in focus about health worker focus. We have first speaker, Tan Chek Wee, our ISRT Regional Director for Asia and Australasia. She has to touch about the various aspects of health worker. And we are very happy to have you today. This is your first speaker, the first session at the Facebook Live here, Chek Wee. Please welcome Chek Wee Tan from Singapore, our Regional Director for Asia and Australasia.
Thank you. A very good morning, good afternoon, and good evening to everyone. This year, due to the COVID-19 pandemic situation, it has highlighted the huge challenges that health workers are facing globally. The global campaign is launched by WHO to emphasize the importance of health worker safety in ensuring patient safety. And hence the theme of this year, World Patient Safety Day campaign is Health Worker Safety, a Priority for Patient Safety. The campaign aims to mobilize patients, health workers, leaders, policymakers, and healthcare industry to speak up for health worker safety to reduce the risk of harm to both health workers and patients. The objective of this campaign is to raise global awareness on the importance of health worker safety and its interlinkages with patient safety. It also hopes to engage stakeholders to adopt strategies to improve the protection of health workers and patients, and to implement actions to invest in the well-being of health workers. Hopefully, with this awareness, it will provide due recognition for health workers' dedication and hard work during the current fight against COVID-19. In June this year, ISRT has also issued a position statement that healthcare employers have a responsibility to recognize radiographers and radiological technologists as key frontline healthcare workers, and that employers have a responsibility to care for their health and mental well-being. Together with this global campaign launched by WHO, we hope it can help to engage the different stakeholders to recognize the issues faced by radiographers and radiological technologists. Radiographers and radiological technologists have played a critical role in this current pandemic situation and are constantly working in a stressful environments, including being infected and having limited access to personal protective equipment and safety measures, all of which may exacerbate risks to their physical and mental health. This may in turn lead to errors which can potentially harm patients and other health workers or the radiographers themselves. How can we as radiographers and radiological technologists enhance the safety of ourselves at workplace and safety of patients under our care? Your own safety starts with you. A lot of time, your health is not just about you. Your state of health can impact your work performance, and you may unknowingly place the patient or the system at risk if you're not well. A healthier you is a safer you. I find that this is very apt to apply the slogans to the current situation where most of us may be overwhelmed by the workload, changes, and stress involved in managing the COVID situation. As radiographer, we often put our patient first and may end up neglecting our own physical and mental wellness. It is important for us to take time to take care of ourselves. Policymakers, employers, and staff all have a role to play in ensuring safety. It is important for policymakers to implement policies and legislations to ensure the safety of health workers and patients. As an example to remind healthcare workers to take care of your health, safety information in the form of games or quizzes may be used to staff engagement and motivate their learning. This is taken from the Singapore National Workplace Safety and Health website. So if anyone is interested do log on to the website to try the quizzes or the games. Training and education. Training and education is important for safety. Radiographers need to be trained and equipped with the necessary skills to perform the procedures, especially in a new environment or under stressful situation with limited resources. The hospital management need to ensure that staff are provided with appropriate training and guidance in managing new procedures or infection control. If physical training is not possible, institutions may explore e-learning modules or webinars to deliver training. During the pandemic, ISRT has been working closely with member societies and international agencies to develop resources for members to use in the preparation and management of COVID-19. These resources are currently available at the ISRT website. Safe work environment. Organizations are legally responsible for establishing and maintaining a working environment where employees are able to work safely, without risk to their physical and psychological health. It is important for our radiographers to know your rights and responsibilities for a safe work environment and report on safety risks or threats to authorities. To ensure a safe environment, institution needs to provide sufficient staffing levels and resources to improve the safety conditions in healthcare and contribute to building and strengthening health safety culture at work. What is safety culture? Safety culture is a collection of beliefs, perceptions, and value that the staff share in relation to risk within an organization. According to the United Nations Scientific Committee on the effect of atomic radiation, an approximation of over 4 billion radiology procedures are performed annually worldwide. As radiographers, we play an important role in safeguarding and optimizing the radiation dose when performing imaging procedures to patients. Developing a safety culture is a core element to improving patient safety and care quality. In order to know how we can make our workplace safer, we need to know what are some of the characteristics of a strong safety culture. A lot of times, safety cultures requires top-down approach. Leaders must be committed to implement safety measures. Hopefully, with this campaign, we can better engage the senior management or leaders to be committed to want to change the work environment or work processes to make it safer for the staff or patients. However, all staff must also be committed to making it happen. Any implementation will not work if either parties are not committed to the cause. It is also important to have an open reporting system to document near misses and incidents without the allocation of blame. Radiographers also need to cultivate questioning attitudes, including reviewing potentially unsafe practices and decisions at all levels, and establish good practice of proper documentation for work processes and practices. Establishing guidelines and standard operating procedures are important in our practice to ensure safety, continuity, and standardization in practice. For the different procedures performed by radiological technologists, it is important to have the standard operating procedures clearly defining the role and responsibilities of all the involved staff, especially when working in a highly stressed environment. The SOP should be drafted in clear and easy to understand formats, such as using flowchart or diagram, so that it can be easily understood by all involved in the procedures. To improve communications, the department may implement daily huddle sessions to update staff on the changes and facilitates easier communication and minimize error. Lastly, the safety, health, and well-being at the workplace of healthcare workers should be managed holistically. It is hoped that with awareness of joint effort by the different stakeholders, we can improve the safety of the radiographers and patients. Thank you. These are my references. Thank you.
Thank you so much, Techwe, for sharing your direct experience regarding various aspects of patient safety. And for the audience, our regional director for Asia and Australasia, Tan Techwe, is working as radiation therapist in her country in Singapore. And we also have another colleague, the leader in the profession, who will come to share her experience also on another aspect of patient safety. We are so happy today to have Pam Black from the UK. Pam is the ISRT Regional Coordinator of Europe for Professional Practice. And she practiced in the UK and she come here to share her experience. Please welcome Pam Black.
Hello everyone, and I hope you're all keeping safe and well on this very, very happy day. My name is Pamela Black, and I am the Regional Coordinator for Professional Practice for Europe for the International Society of Radiographers and Radiological Technologists. I also work for NHS England and Improvement as part of the national team and I am the National Imaging Transformation Implementation Lead for Capital Equipment Replacement. I'm honoured to have been asked to talk to you today about enhancing safety of health workers and patients. The World Health Organization in 2019 showed that there were 134 million adverse events in hospitals, and this ranges right across all aspects of health and safety in the workplace. It's one of the 10 leading causes of death and disability. Today I'm going to be focusing mainly on radiation safety in the workplace, and radiation incidents and the overexposure of radiation have decreased over the years. However, there is a high degree of unreporting of radiation incidents and accidents and mistakes that we make. And coupled with an ever-increasing demand for radiology procedures, this will increase the likelihood of such incidents. Generally speaking, radiation safety is regulated at country level. However, at international level, there is the United Nations Scientific Committee on the Effects of Atomic Radiation. There's the International Atomic Agency, the International Committee on Radiological Protection, and all of these serve to evaluate risk and to make recommendations and primarily promote the safe use of radiation and associated techniques. So today I'm going to be focusing on first steps to improving safety, and you need to consider adapting a logical approach. So in radiology and X-ray departments, what are the key areas that we need to look at when we start considering this? Staff and patients and colleagues, the equipment that we use, the environment that we are working in, and how we have reporting processes and develop procedures to continue to improve our safety. This is by no means a complete list, and in fact should just be regarded as first steps. So as part of these first steps, I'm going to concentrate on staffing and patients. So what are your key roles in radiation safety? As radiographers and radiological technologists, our key responsibilities are to protect ourselves and to protect our patients. We do need to understand our rights and obligations, and we need to be able to recognise hazards and risks. And what do we do about them when we've seen them? What action do we take? And how do we report incidents? Firstly, you need to protect yourself, your colleagues, and your patients. Protecting our patients, it's important to make sure that we have the right patient by checking their identity, having the right examination, the right body part, making sure that we justify the examination, and by that I mean we make sure that what the request is asking for is what the patient thinks they're going to have, and that the clinical information matches the request. For example, if we get a request that says a patient has had a bad cough for several weeks, we would expect to see a chest x-ray. If we saw right hand, then we'd have to stop and think about where the error is. The request should be signed by a qualified health practitioner, which generally around the world is usually a doctor. We need to ensure that we correctly position the patients so that we can make sure that we do get the correct site. And selecting the exposure factors. If we don't have them already programmed into the equipment, then we should be looking at dose charts and making sure that there is consistency and standardization. And if at all possible, we should be recording either the dose or the exposure factors so we know what we've given in the event of any kind of errors. So what do you do in the event of an error or an issue? And I shall come back to that towards the end of my presentation. The next thing I'm just going to talk about is equipment. What is your role with regards to equipment? Well, first and foremost, you need to be able to use it safely, and all staff should have training on the equipment. Even when you know how to use an X-ray machine or a CT scanner, if you use a different type of machine, you do need to make sure that you understand the differences and how to use it safely. We need to undertake what we call the quality assurance checks on the equipment to make sure it does what it's supposed to be doing. For example, undertaking output tests to make sure that the radiation dose and the exposure factors that we set are delivering the dose that we expect, and that we don't have to set higher doses to get a particular image or an optimized image. Collimation, we need to make sure that when we do collimate, we know that it is accurate and that we're not cutting anything off or we're not overexposing the area. The image quality and the resolution needs to be good, and it needs to be high quality, and it needs to meet certain standards. And to make sure all these things happen, we should have regular maintenance checks and making sure that the equipment is safe to use, and that should be provided by somebody who sold the equipment or a hospital engineer or somebody suitably qualified. A record of all of these visits need to be maintained so that we can keep an eye on how the equipment is performing. And we also need to consider local rules. These are instructions that are designed to restrict exposure to radiation. And local rules are exactly as they say. They're rules that are local to your equipment and your department. The next thing I'm just going to consider is the environment. What is your role with regards to the environment? Well, the environment you work in is the X-ray room itself, or the CT scanning room, or any equipment, any room where you have your X-ray equipment. The X-ray rooms will have already been built, and they should be lead lined or barium plastered. And there are tests to check if the radiation dose does leak outside of that room. But simple approaches to improving safety should be locking the doors during the examination, so you don't get anybody just wandering in while you're in the process of X-raying a patient. And not only does this prevent any overexposure, unexpected exposure to somebody other than the patient, it also improves the privacy and dignity to that patient who's having their examination. Signs on the doors and around the department alerting to people that there is X-radiation in use should be displayed. Ideally, you would have a light on the door of the X-ray room so that when you make the exposure, the light comes on, warning somebody not to come in. But not everybody takes any notice of it, so locking the door is a good thing. Wearing personal protective equipment can protect you and can protect your patients and people who are helping you to support the patient in the room. Ideally, you would never have anybody in the room while the patient is being X-rayed, but sometimes with a small child or somebody who can't keep still, there are exceptions that can be made. You should also use your personal protective equipment to support the patient and to protect them as well from radiation. You should keep records of all the incidents that occur. You should keep records of any breakdowns and make sure that you take all the details. And again, you have your local rules that pertain locally to you as to what's going on in your department, in your environment. And again, I ask the question, what do you do in the event of an error or an issue? So, what do we do? Well, we need to report all incidents because it makes the workplace safer. You should report your concern to the management team. and you should feel able to do so without fear of reprisals. You need to document the incident and the issue, the date, the time, the people who were involved, and exactly what happened. And then you need to understand what happened to identify the root cause. What actually happened? Where did it happen? Why did it happen? Who was involved? And what can we do to stop it from reoccurring? Sometimes it's the simplest of things. For example, as I mentioned before, if somebody walks into an X-ray room when you're making an exposure, they're going to have an unintended dose of radiation. So what's the simple thing to do? You lock the door, but you make a record and it goes down as part of the training, and it goes into your local rules to say, whenever you're taking an examination, you lock the door. You need to agree with everybody in the department with whom you work that this is the right approach, and document the outcome and identify, write down. You can implement the required changes, put them in place, and then review them to make sure that it's actually going to stop the incident from happening again. And the most important thing is to share these changes with all the staff and ensure that everybody understands. That's just a very, very brief overview of looking at how you can improve the safety of workers and patients in an X-ray department specifically related to radiation. It is just the beginning. The next steps would be consider having regular meetings to discuss aspects of improving safety, where people can ask questions, where questions can be answered. It's not necessarily going to be the superintendent and the managers of the department who have all the answers. Many members of the department will have an idea of how to improve things. Although it's everybody's responsibility, it is a really good idea to have somebody to take a lead on this, somebody who's interested and who wants to improve things. And as I've said before, in radiology and imaging departments, radiation safety is just one aspect. If you have a magnetic resonance scanner, there are safety issues around there. The administration of contrast media, again, needs to be looked at, and you need to have your processes and procedures documented, and everybody needs to be able to understand and to read them. As I've just said, writing up procedures that should be followed is really quite important, because it allows everybody to take time to read what they should be doing and to make sure that they are doing what they're supposed to be doing. And in the event of making any changes, then the procedures can be adapted to show that they have been improved. And regular training for all staff so that they understand any changes that have happened. And we don't have anybody saying, I didn't know about that, nobody told me. So thank you very much for listening to me today. It's been a great pleasure, and I hope that you've learned a tiny little bit about radiation safety, and that it gives you something to think about and to take forward. Just before I go, I am from the United Kingdom, and I am from the greatest city in the world, Liverpool. So hence my photographs. Thank you very much.
Thank you so much, Pam. We heard a lot of practical approaches from you, especially when we practice as radiographer, how to improve patient safety. We will come back to you during the Q&A session. And for colleagues around the world, if you have any question or comment, please do so at the comment box, and then we will get back to your question to ask to the speaker, the panelists. Well, we have the last speaker. He is the ISRT Regional Director of Europe, Tim Akadagos. Tim, he practices radiographer in the hospital, and he will share his experience, especially the patient focus. Please welcome Tim.
Hello, everyone. First, I would like to thank the organisers and fellow ISRT board members, as well as the President, for their kind invitation. I am delighted and honoured to be part of the World Patient Safety Day 2020 webinar with experts in their field. Today's presentation aims to highlight the significance of our professional role during this pandemic in upholding the functionality of healthcare systems. In addition, participants will be informed of the major resource platforms available for managing suspected and confirmed cases and the 5 fundamental principles necessary to establish a safer working environment during the era of COVID-19. A single glance at the WHO dashboard is more than enough to grasp the severity of the situation. The data demonstrate that healthcare systems were too weak and staff were not prepared to detain the impact of this pandemic. Just as the global death toll from COVID-19 climbs to staggering new highs, so grows the number of those lost on the front lines trying to help those infected. The healthcare workers are among the 926,000 deaths and 29 million confirmed cases of COVID-19 worldwide as of Tuesday, the 15th of September 2020. These numbers can be seen in detail on the PowerPoint. On the 3rd of September 2020, the Amnesty International found that at least 7,000 healthcare workers have died around the world after contracting COVID-19. So far, we know of 2 radiographers in the UK and a mammography technologist in the US who have lost their lives due to COVID-19. You know, some of these deaths were preventable. Poor preparedness, government missteps, and overburdened healthcare systems increase that risk. Inadequate access to testing, a global shortage of PPE, and resistance to social distancing and mask wearing have forced more patients into the already overburdened hospitals, increasing this death toll. Admittedly, healthcare workers are more vulnerable to COVID-19 infection than the general population due to frequent contact with infected individuals. They are therefore at a greater risk of getting infected and dying, which is further exacerbated if they are not adequately protected. Now, these weak points, these gaps in the healthcare systems became apparent when several clinical radiographers in hospitals and institutions complained of limited access to personal protection equipment, inadequate staff training, shortage of PPE, reduced understanding of PPE use, and confused PPE guidance. In addition, healthcare authorities and employers in several countries did not consider radiographers, radiological technologists as frontline healthcare professionals, despite the fact that medical imaging is the basis of the majority of medical decision algorithms. Fortunately, the World Health Organization, the ISRT, the Society of Radiographers in the UK, as well as several national radiographer societies were quick to respond, opposing this viewpoint with relevant recommendations and position statements to ensure radiographers, radiological technologists are recognised as frontline healthcare professionals and should be provided with PPE consistently. Moreover, our key role as frontline healthcare professionals is enhanced for 2 reasons. First, radiology department preparedness for COVID-19 is inevitable without radiographer involvement, as you can see in numerous publications which are shown to the right of the PowerPoint. And the second reason is simply because chest radiography and chest CT are recommended for the confirmation of COVID-19 pneumonia and for monitoring the disease. And this can be seen on the Rapid Advice Guide, which was published on the 11th of June 2020 by WHO, to your left. The latter means that suspected case will be confirmed early, managed efficiently, and will be transported with the necessary safety precautions directly from the medical imaging department to the ward or the clinic. No stops in between for other testing. Dear panelists and participants, we are aware that these examinations, that is the chest radiography and chest CT, can only be performed by radiographers and radiological technologists. We are also aware of the fact that radiographers, radiological technologists have been working as frontline professionals before COVID-19 and will continue to do so after. Well, we hope so. So, has something changed in our professional practice during the COVID-19 era? Haven't we provided medical imaging and therapy services to patients with highly communicable diseases in the past? Well, we have, but now we must overcome an airborne disease with an amazingly high transmission rate. The risk of infection is great, yet radiographers, radiological technologists must continue to produce and deliver medical imaging and therapy services under these strenuous conditions and in unprecedented times. Therefore, it is vital that we practice safely, implementing suitable safety precautions to protect ourselves against infection and to avoid lengthy isolation, to mitigate the risk of contagion among patients and staff, in order to safeguard the national healthcare system. General safety precautions against COVID-19 for healthcare professions have been developed by WHO, ECDC, CDC and national public health authorities. However, the ISRRT has an e-learning platform which has dedicated COVID-19 section with input from accomplished academic radiographers and clinical practitioners. It comprises of the ISRRT related position statements, e-courses, procedure checklists and guidelines. All these can be retrieved free of charge at the links shown just under the title of the slide. Similarly, the EFRS, the Society of Radiographers, and many national radiographer societies offer resource material on COVID-19. At this point, I feel obliged to highlight the initiative made by the Pan-Hellenic Society of Radiological Technologists in Greece, as it was the very first national society to develop practical guidelines for radiographers during the pandemic. These were conveyed through a series of modality-specific webinars as early as the 20th of March 2020 and an e-conference. Now, once radiographers visit these aforementioned web pages, they will be familiar and are expected to implement the following 5 fundamental principles. Separate red from blue zones, exercise donning and doffing procedures of PPE correctly, apply hand hygiene effectively, to ensure appropriate and frequent room equipment, decontamination, disinfection and ventilation, and last but not least, practice with transparency. Let's see these separately. First, to separate the red and blue zones, where red is the contaminated, the hot area, and blue is the non-contaminated, the cold area. In the cold area, we do not wear gloves, just the mask. At times, we need to rearrange waiting areas and install barriers to encourage physical distancing. The second principle is donning and doffing. During donning and doffing procedures, it is advised to have someone assist you, especially during the doffing procedure, to avoid self-contamination. Always remember to sanitize hands in between stages of doffing. Third principle, exercise the WHO 5 moments of hand washing technique, where you wash your hands with soap for 40 to 60 seconds. Before the patient, before the aseptic procedure, after body fluid exposure risk, after touching a patient, after touching patient surroundings. When it comes to disinfection and ventilation, you need to ensure that this occurs appropriately and frequently in the room and the equipment and according to local regulations and vendor specifications. It is recommended that radiographers, radiological technologists discuss this procedure with the hospital's infection committee and to inspect cleaning staff when performing the task. We need to practice with transparency, that is to record suspected and confirmed cases and report relevant incidents. This action is very important as it often helps in informing staff involved in the procedure of a suspected case which was confirmed as COVID-19 eventually. Finally, I would like to share my experience with you. The advantages of PPE and masks are profound, but radiographer-patient interactions have now become somewhat tricky. How do we communicate with patients when they cannot hear what we say? How do we gain their trust when they cannot see our smile? How can we show our empathy when we cannot hear what they say? I'm hoping that masks will not inhibit radiographer-patient interaction. And to conclude, Despite all measures and safety precautions, radiographers, radiological technologists remain at the point of service, and thus maintaining a physical distance of 1.5 meters from the patient is inevitable. They are committed to patient radiation protection, patient safety, and have a key role in safeguarding the healthcare system during and following this pandemic. We can only ensure this by adhering to the safety precautions developed by national societies, and of course the ISRT, which has reshaped the WHO, ECDC, CDC guidelines, especially for radiographers and radiological technologists. Thank you for listening. Stay safe, stay protected in order to protect.
Thank you, Tim, for your comprehensive talk, and that's direct from your experience in the clinical environment that you have, and also showing the activity that your professional society in Greece, what you have done so far. Very, very impressive talk from all the panelists today. And now it's time for the Q&A session. The audience from around the world, you still have time to type your question down at the comment box, and then I will bring the question to the speakers here. What I got so far, the first question may be for those speakers who are currently working in a clinical environment. The question is regarding the accidental exposure to other staff of the radiology department. Shall we need to report with the incident report form? What do you do in UK, Pam?
In the UK, we have to report all accidental overexposures to anybody. So if it is, did you say it was to another member of staff?
Yeah, other member staff of the radiology department.
Yeah, we in the UK, we have to report everything. So if a member of staff inadvertently walks into the X-ray room during the exposure, then we have to document that, and we have to provide all the information as I was outlining, the exposure factors, and also we have to investigate why and how that occurred. I mean, were they not following the procedure, or had something happened accordingly? And that's what we have to do every time. Thankfully, those kind of incidents are relatively rare, she says, because we lock the doors and we have so many procedures in place.
Oh, yeah. I think what you have presented is very good. It's very practical, and I'm sure that the audience from around the world that follow this Facebook Live webinar, they will learn a lot from you, and especially your current practice in the UK. What about in Greece, Tim? What do you have to do the report in this kind of situation? Tim, you need to unmute your microphone first. All right.
I'm okay?
Yes.
Similar to the UK, everything needs to be reported. But another trick that we perform in the hospitals is not to have a doorknob on the outside. That way nobody can open the door. And sometimes what we do, they can only come through the console. And the other practical tip is to have safety switches, so when the door opens you cannot irradiate the patient, especially in high dose modalities like in CT where I practice.
All right, thanks for the answer. I think we would go ahead with another question. This question goes direct to Dr. Perez. Is the World Health Organization finding that the member states are now having adequate resources for PPE education, or is there any gaps that still exist and need to be addressed?
Thank you very much for this very, very good question, because if I understood correctly, you talk about the PPEs, but also the education for this, which are two components. When in my talk, I referred to the four major components to ensure IPC. One is having appropriate PPE, and that is a challenge, but now that challenge is being tackled with investment, donations, etc. But the second bullet point about training for the appropriate use of PPE is still a gap, because things are happening so quickly. Countries are receiving the equipment. In some countries, this is still a gap, and we should recognize that not all hospitals in the world have still the appropriate PPE. But even those who have, in some cases, education for appropriate use is not enough. So I am really surprised, not surprised, I know how much you do, but it's a lot what you are doing, and the resources you have now for COVID, particularly for the management of COVID-19 pandemic. I think that more than ever, you and the other stakeholders that you have a key role, you should improve, and we are very happy to have you as a collaborating an NGO in official relationships to do more on education and training on appropriate use of PPE. Mm-hmm. And a big challenge is to do that at the same time that we are keeping in mind that we should also have radiation protection.
Yes.
This is a challenge. We receive questions, particularly, now that more than ever, point of care imaging is being done, because it is recommended to do with portable equipment, to do X-rays in the intensive care unit or in the emergency department. And you have to use the PPE, but at the same time, you should consider protection of the people there, or much more in interventional radiology, where you have to use much more complex radiation safety protective equipment plus the PPE. So my answer definitely is yes, there is a need, and we need stakeholders, and we need the health practitioners like you and others to work with us and with other international agencies to improve education and training. Thank you.
Thank you, Dr. Perez, and you always work together with us, and we are always happy to work with you. I think I can forward this question to both Pam and Tim. Let's start with Pam. What is your experience about this in terms of the PPE education and how you do deal with the PPE situation when sometimes at the peak of the pandemic, some places don't have enough?
I might not be best placed to answer this, to be honest, because during the height of COVID, I wasn't working all the time in the radiology department. And for the most part, when some of the PPE wasn't available, and by that I mean some of the masks and some of the staff were failing, or they weren't failing, but the masks didn't fit them, then we had to rearrange their duties. And so that caused quite a little bit of problems for staff having to go out to the intensive care units to take imaging of COVID positive patients, because it always fell to the staff who were able to wear those specific masks. But in my trust, I wasn't aware of a great deal of shortage of PPE generally, and I think perhaps Tim might be better placed to answer that than myself.
All right, thank you, Pam. Let's move to Tim. What is your answer for this?
Well, if you have shortage of PPE, there's not much you can do. You need to improvise, and that's what we did in many Greek hospitals where there was shortage of PPE. Just putting a second or even a third surgical mask instead, or keep an older FFP3 mask on. And now, as far as training on how to perform the donning and doffing procedures, now that was quite challenging, because most radiographers were trained from each hospital's infection prevention and control committee, which was very difficult because it was like a very simple workshop, and it was quite dynamic. But difficulties that were reported to me as the president of the Greek Society was that they were actually trained without the actual PPE. So how can you be trained on how to don or doff PPE if you don't actually have PPE? So that was a problem. So what we did as the Greek Society of Radiological Technologists, we had webinars using videos of donning and doffing as a first, and then we just spoke to the hospital infection control committees so they can upgrade their educational material and include more radiographers as frontline healthcare professionals, because we had that problem in Greece. We were not recognized as healthcare professionals. So we used the World Health Organization statements and the ISRT statements to push this forward and get appropriate PPE and adequate PPE.
All right, that's very good. How about radiation therapy? I know that during COVID time, a lot of hospitals just postpone the investigation if the patient can wait. But for our cancer patient, they can't. What do you do? How do you deal with that, Checkway, in Singapore?
Okay, so as much as we can, we try to postpone the patient. So based on safety guidelines, but if you can't, you still have to treat the patient. So we actually have to practice safe distancing and then team segregation. So we try to divide the department into team A, team B, so that just make sure that there's one team is clean. So in case one on machine is down, the other machine still can continue to work. So it's more of a team segregation and then strict safety distancing from all the way the moment the patient step into the hospitals. So we do temperature taking for patient, and then for staff, we have to do twice daily temperature tracking also. So as long as the staff is not well, they are not advised to come to work.
All right.
So as much as we can, but I mean, we will just be putting on surgical masks. So unless patient is not well, so usually we have screening. So unless patient is not well, so usually they'll be isolated and then test. So once it's confirmed, it's clear, then we'll do the treatment.
Oh, all right. I see. What about nuclear medicine department, Donna? How did you deal with that?
Yeah. Appa, for asking me that. It's interesting. You would have expected this to be an issue that was only happening in underserved or low and middle income countries. But interestingly enough, that shortage of PPE happened everywhere in the United States. And so we actually had to go to wearing extended time with our masks. We were our COVID center in my city, so we received all the COVID patients. And we did COVID patients in high numbers in my department. And so it was interesting for me. What I see as a gap is as things are changing, as we're learning more about the COVID pandemic, and as we're learning more about the changes or when you wear a mask, when you don't wear a mask, all the PPE protection, how much virus a person contains, or when you can come back to work, that our education isn't keeping up as we are changing. And it's much out there that which education is appropriate now. When can the healthcare worker come back if they have been exposed? That information, I think we still need to continue to develop education. I find that in my hospital, and I think we might find that across the world, that as we're learning more about it, we need to revamp our education to try to address, as we're learning new things from the CDC, the WHO, about giving the right information to our healthcare workers so that they can protect themselves, protect patients correctly. Because this came so fast, we learned quickly, and it was hard to keep up with producing the correct education for people.
All right. I think the next question is a continuing part of the current question. The question is, do you find that there is a focus on personal health with healthcare workers in your area of the world? Do they have to add it in the yearly education requirements in the hospital about this personal health of the healthcare profession? Let's start with Pam. What is the situation there in the UK?
Thank you. I think the situation is, as you have said, that we are very much encouraged to take better care of ourselves, and the trusts, the hospitals are there providing support and guidance for the most part in making sure that the health of the staff is paramount. I actually don't work in a hospital anymore. I work for NHS England and Improvement, And on my laptop, every day when I log on, there is lots of flashing images about what support there is, because there has been many changes for how people are working during the COVID crisis. Lots of people are working from home, including radiologists and some radiographers who don't actually, I know it sounds a bit incongruous, but some staff do have roles that can be undertaken remotely. But within the departments, that the lots of arrangements were made and continue to be made to support staff who have who might have to isolate, or their families have to isolate. So it's I think Donna was saying earlier when we were having a chat, as much as it's absolutely awful and it's so tragic for many people around the world, there are lots of good things that have come out of it, and not least the fact that there's a recognition that our most important resource is our staff.
All right, that's very interesting. Dr. Perez, do you have any comment on this issue about the healthcare worker health focus?
Yeah, I think it's also a very timely question, because it's not. This is the main reason why the theme of the World Patient Safety Day was, in a way, changed, because there were many topics proposed in January, February, when this was discussed. And very soon after the start of the pandemic, the topic was selected. And the reason is because I think there was a change in the focus, but not in the focus itself. We will never lose the focus of patient safety. It was a shift in the approach on we cannot protect patients if we don't protect health workers. And this, in my beginning of my professional life in radiation protection, let's say 3 decades ago, I used to work also in radiation emergencies. And in that area, we learned, because we use the approach that you always use on pre-hospital response, for instance. You should save the rescuers, the first responders, sorry. You should take care of them, because every single first responder you lose, you will lose a lot of people, many victims. This is a culture in emergencies and in pre-hospital response. We didn't have this culture in the daily practice of healthcare, and particularly now on radiation for radiographers, for instance. But now we understand that we should protect the health workers, because if we lose them, we will lose many patients. Yes. We need them. We need you. We need every single worker, radiographers, clinicians, intensive care. All the healthcare providers now are really in the front line. We need them in this battle. But this is for COVID. But we should learn this after COVID. And I think the colleague from Greece, you talk about now, but after COVID. I think we should change for after COVID to think about patient safety very close to health worker safety. One without the other is really not possible, because it's part of the safety culture. We have to have a culture of safety for both, and then a culture of respecting also ethical values. Ethics was mentioned today by some of you, respecting the ethical values also in applying the radiation protection principles. Thank you.
Thank you. I can't agree more, Dr. Perez, on this issue. And what about Stuart Willie, our Director of Professional Practice? What is your view of this issue as the ISRT?
I think it's extremely important, and it all gets down to the management's view of their staff, and management has to sort of take a very positive view of their staff and to look after them. It's something, as a previous manager, I always invested in my staff. It's a matter of communication. It's a matter from the first day that they're appointed. It's a matter
when you advertise for staff to come and work in your department, you want to attract them to a place where they'll want to stay for the rest of their career. So it's extremely important that the tools are there, that all the enabling factors are put in place to ensure not only their safety, but their general welfare and their well-being. So set up those mechanisms whereby you've got an open door policy where the staff can come in and speak to their boss, that they know their boss is caring, but also their boss is efficient and that they will stand up for them. So I think once you have those structures in place, the staff will have a sense of worth, and if they have a good sense of worth and want to come to work, I think they will come in a positive attitude. And of course, the education bit is so important. You must start the day communicating, setting down the tasks, constantly having those weekly meetings, having that health and safety team that's in place, that radiation protection supervisor or the equivalent health and safety representative, recognizing them and not just playing lip service to them, but emboldening them to do their job correctly. So I think, trade unions have a large part to play in this as well. So in recognizing trade unions and getting them as part of the team, it is a team effort when it comes to the bit. There shouldn't be any barriers. Well, that's my own personal belief, and I think that echoes what ISRT is all about: building teamwork.
Yeah, that's great. I think we spent quite a good time period to present this topic, and come to an end. I would like Dr. Perez, our keynote speaker, to give some word to the radiographers colleague around the world. We have 500,000 of us waiting for your speech.
Well, thank you very much. I will not take much of your time. We already spent a lot of time, but it's so nice that we could continue. Just to let you know, today, all over the world, people are gathering to celebrate this. Health workers and patients. Our network of patients for patient safety is very active, and you know them because we have been working with patients also with you. And today, all the many emblematic, iconic buildings will be lightened. Some of them already lightened in orange. And this is a very symbolic thing to think about patient safety, but today especially to protect the safety of our health workers. So my final message is that I think we learn we discuss many interesting topics. I think one point I want to come back again is let's have a shift in our approach without avoiding this separation of today we discuss patient safety, today we discuss occupational radiation protection or occupational safety. Let's think about quality and safety in healthcare. It's just one concept, embedding all these aspects of quality and safety, protecting the patients and the workers. And my final message is also to encourage all the professionals, but in this case, particularly radiographers and radiological technologists from all over the world, to be very active, to support the ISRT, but also your respective regional federations or societies or national societies to do more work on awareness raising. We need to do more awareness, advocacy, and education and training. And for that, to repeat, WHO is really committed to continue and expanding our collaboration with you in this area. Thank you very much for this opportunity of sharing this celebration with all of you. Thank you.
Thank you so much, Dr. Perez. And now it's time for our President, Donald Newman, for her final speech.
Yes, I want to tell all of our key experts, one of the great things about the ISRT is their member societies and our key experts from around the world. Without you today providing expertise, we wouldn't have been able to present this important information. And I think it is wonderful to have a global voice for radiographers and to collaborate with the WHO. You guys actually produce the top document that our members need from all over the world. And we appreciate the opportunity to officially collaborate with you and be involved and be sure the radiographers' voice is heard. And I want to encourage everybody to please take time to celebrate World Patient Safety Day. It's an important aspect, not only for our patients, but for ourselves, and to continue to bring grassroots efforts to bring this all over the world so that people are aware that health safety is important for the worker, healthcare worker, and for our patients. And so we will continue to collaborate together. I thank you again, all our keynote speakers that spoke today, and let's take the rest of the day to celebrate and to bring a public awareness message. This is very important. We are the voice for radiography. Let's make sure people hear us. Thank you.
Thank you, Donna. What a great program we have today. And again, thank you, Dr. Perez, for coming here as the keynote speaker. And all the speakers we have, Pam, Checkway, Tim, and also our professional practice, Stuart Whitley. And we cannot forget to thank one special person, Yuttapon Vishanin, our Director of Education, who worked so hard to make this webinar and Facebook Live happen. Thank you so much, and goodbye, everyone. Have a nice day. Thank you.